Yep, I'll share my screen right now.
Hi, good afternoon, everybody. My name is Amanda Shirelli, and I am the organizer of the HERizon group. For the month of July, I would like to welcome Carina Marzec from the Office of Emergency Management at Mercer County. She's going to be talking about service animals and what they do in a disaster. So, without further ado, I would like to welcome Carina Marzec. Thank you, Carina, for joining us today.
Thank you, Amanda. Thank you so much, Lisa. It's a privilege to be here with you. And this is a topic that's near and dear to my heart because not only do I work in emergency management, I'm a county emergency planner, but I also am a person with disabilities, and I actually have two amazing service dogs who make my world bigger. So, one group that I'm very fortunate to be a part of is what's called the New Jersey Service Animal Working Group. And what that group is it's a team of subject matter experts from different interdisciplinary groups, people with service animals, people from different organizations, emergency management personnel, and more. And what we do is we look at ways to improve access and awareness and preparedness for people with service animals in New Jersey. And that group is under the New Jersey Department of Agriculture. And I have at the end of the presentation today, you'll see a resource page which has a link to their website. They have some fantastic resources to help. So I love talking about readiness and resilience because for those of us with disabilities, planning is just such a natural part of who we are and what we do every day. We all know that just going someplace nearby takes planning. We have to plan for medications, we have to plan with our equipment, transportation, everything. So there's such a natural tie-in in our community to being ready for anything. So when we talk about readiness and resilience, I know many of you have participated in programs in the past, whether it's Pathways to Preparedness or familiar with the concept. But for anybody who's just coming into it, one resource I like to refer to is ready.gov. There's a lot of great information there. And if you are a person with a service animal or with any disability access functional needs, please make sure that you visit the Register Ready program site for New Jersey. And what Register Ready is it's a planning tool that helps us capture information about how many people in an area have what kinds of needs. So while it's not a substitute for preparedness, we still have to each make, because our needs are so individualized as well, we all have to make that extra effort to take those steps to be better prepared. But what Register Ready does is it's a planning tool to help us plan for what kind of needs are in the community so that we can be better prepared and aware of when a situation arises. Okay? So, just like we talk about for ourselves, we want to make sure that we're prepared for two potential scenarios. One is if we have to stay home, we have to shelter in place, stay where we are for a couple of days, or we may have to leave our homes. So we all think about with that. Usually we're thinking we want to make sure we have non-perishable food for ourselves. We want to make sure we have bottled water. We always want to think ahead about refilling medications, etc., as early as we are able to make sure we have what we need on hand. So very much the same for our pets. We want to make sure that we have supplies on hand for them. And we all know that transportation for people with disabilities can be a little bit more challenging. So finding ways to think ahead about, well, how much time do I need to get ready? What can I do in advance to help stabilize my situation? And whom can I reach out to are all very important things to reflect on. So if you may already be familiar with it, but there's very often in New Jersey, you can call your local health department, local animal control, and ask about things like, is there a free rabies clinic in my town? Because part of preparedness too is if we help our animals to stay as healthy as possible before an incident, that way when there is an incident, just like us, if they're a little bit healthier, it's going to be a lot easier. Plus, if we ever have to go to a shelter with our animals, it's very important for them to have that rabies vaccine so that they can be housed close by as possible in the building. because otherwise it gets difficult in terms of handling, because it's very important to keep those rabies vaccines up to date. There's also the option of looking into low-cost vet clinics. So I always recommend, when we're talking about blue sky, nice day stabilization, things that can help us get better prepared, consider reaching out to 211. Check their website, call your local health department, call your local human resources, and ask about things like low-cost veterinary clinics. Sometimes there might be a little bit of a wait for them, but there are different programs around for low-cost vet care, and then also very often there are rabies clinics in the areas. Okay? So know your animal's unique needs. Whether you have a service animal, an emotional support animal in your apartment complex, or pets, most of us, we pride ourselves on knowing our different animals and what they need. So whether you have a bird and you know about having to maintain temperature for it, or whether with dogs and cats, I have one of my dogs who's a service dog. He is the one who's always cold. He needs to have a sweater in his go bag because if it's chilly out, he's going to need it. The other one's always hot, so I actually put a little small fan in her bag because she's got longer hair. So it's things like that. Know your animals and talk to your vet when you're planning ahead for your pets. Because, for example, some people's animals don't do well on car rides. They tend to get a little car sick. So talk to your vet about what might help. And if you know that your animals tend to get anxious if they're going to a new area, just remember, if you have to go to a family member's home, friend's home, or even an emergency shelter, make sure you've already talked to your vet when you have a follow-up visit, yearly visit as the case may be, and make sure you discuss what might help. Okay? So just like ourselves, we want to make sure we have extra food, water. Again, we talk about medicines for our animals, both set aside for if we're home for a couple days or if we have to go someplace else. And make sure you have an extra leash or harness. You want to make sure you get extra ID tags. And what we always recommend is what we call double leash. So if anybody here has a pet that whenever there's a thunderstorm, even miles away, they kind of get a little anxious. Maybe they have a favorite place they like to hunker down and hide. So these are why we recommend using 2 leashes. So that could look like your dog is wearing a harness with a leash, as well as a collar with a leash. Sometimes people use what we call a slip leash, as well as a regular collar and leash. And the reason we say put 2 on if you have to evacuate and your animal is stressed is that way if one fails, you have a backup in place. They're already in an extra piece of equipment, so it's going to be easier to help keep them from getting loose. Okay? So remember something too when we talk about the importance of having pet food on hand for your go bag, and make sure you rotate it through just like you do for your own supplies, is talking to your vet so important too, because wet food is helpful in an emergency if an animal's stressed because it has more moisture content. It actually helps them stay better hydrated. But again, we don't want to suddenly switch foods because we all know that that can give them a stomach upset on top of already feeling a little stressed. So plan ahead with your vet and talk about things like feeding as well to see what's going to be the best option for your animal. So now that we've just covered a little bit of a refresher on preparedness for ourselves and our pets, let's talk a little bit about service animals and what exactly a service animal is. So service animals are only 2 species. They're dogs and miniature horses. So I'm sorry to my beautiful friend the peacock, but the ADA recognizes dogs and miniature horses only. So I'm going to ask a question. If anybody wants to take a guess, would you say the service animal is A, the Chihuahua, B, the cute little beagle, C, that gorgeous German Shepherd, or D, some other answer? If you said D, you have the correct answer. All of them could be a service dog because service dogs can be any size and any breed. They are task and behavior based. So we're going to talk a little bit about more of that in just a moment, but let me touch on something here. Miniature horses are still covered under the ADA. They're under a separate provision in the ADA. Very often they do tasks like mobility because they are truly sturdy little workhorses, no pun intended. And they also have been used as guide animals, etc. So they do, just like dogs, work or tasks that they've been trained to do for an individual with a disability. So when we talk about accommodating a miniature horse, you're going to see this again. We talk about dogs as well, very similar. They have to be housebroken. And yes, you can house train a miniature horse, just like a dog. And we're going to talk about that more in depth as far as what it means. They have to be under the owner's control. And the question is, can the facility accommodate a miniature horse's size, type, and weight? Usually they only get up to about around 100 pounds. Okay? And whether the miniature horse's presence would not compromise legitimate safety requirements necessary for safe operation of the facility. Okay? So to cover a little bit more what I mentioned earlier with the different size, I'm going to ask you a question. What size dog do you think you would need if you have hearing differences to alert you if someone is trying to talk to you, or if an alarm is sounding, or a phone is ringing? The answer is going to be any size, because depending on your lifestyle, a smaller dog may be easier. I have a friend who often travels for business who has a dog who's a service dog, provides hearing alerts. They travel a lot on an airplane. For them, they got a smaller dog who helps them because for their lifestyle for work, it's a lot more convenient. Again, it just comes back to what you need as far as tasks and skills and your lifestyle. So whether they're tiny or tall, what matters is that they can do the job. So I'd like to share with you the definition of a service animal from the ADA. So the Americans with Disabilities Act defines a service animal as a service animal is defined as a dog that has been trained individually to do work or perform tasks for an individual with a disability. The tasks performed by the dog must be directly related to the person's disability. And that's from the ADA.gov. And you can also check out, if you Google ADA service animal frequently asked questions, they have a great FAQ page that is a really helpful resource. And again, just remember, it also does include under a separate section the provision for miniature horses as well. So when we talk about work or tasks, performing work or task, what does that mean? The dog has to be trained to take a specific action when needed to assist the person with a disability. So we're going to go into greater detail on this in a quick moment. But for example, just to introduce the topic, a person who has diabetes may have a dog that's trained to alert them when their sugar is getting too high or too low. A person who has depression may have a service dog that's trained to remind them to take medication. And somebody who has seizures may have a dog that can help detect the onset of a seizure and then even help the person to remain safe during it, making sure they don't hit their head, helping to position them so they could breathe easily and the like. Okay? So, important thing to know, service dogs don't have to wear any special harness, equipment, or vest. There's only two questions that we can ask to determine if an animal is a service animal. And that first question is the dog a service animal required because of a disability? The second question we're allowed to ask is, what work or task has the dog been trained to perform? It's important to note that someone cannot ask about the person's disability, require medical documentation, require a special identification card, or training documentation for the dog, or ask the dog demonstrate or perform work or tasks. And the reason that's very important is if that dog is providing, for example, an alert that somebody's about to have a medical emergency, we don't want to have somebody in a situation where they're getting sick. So this is, again, very important to be familiar with, is that there's only two questions that can be asked. As I mentioned earlier, there's no requirement for a specific vest, a collar, a harness, or a leash, or identification tag. If you've been on Amazon lately or any website online, any online vendor, I should say, if you typed in service dog items, you could see there's a whole bunch of places that'll sell you an ID card, a vest, everything like that. So right there, that's the reason we're going, it always comes back to those two questions. Those are the two questions we can ask. Okay. One of the reasons that some people will prefer not to have their service animal wearing a vest is because we don't always want to stand out in public. We don't want to seem like a target, an easy mark for somebody who might, be up to no good. There's also privacy concerns. So, for example, sometimes a person with disabilities may not want to broadcast widely that they have a disability to other people. Sometimes you just want to be somebody out walking your dog, okay? There's also privacy concerns, again, comes back to maybe not wanting everybody in your neighborhood to know that you're a person with a disability. So often service dogs will be on just a regular leash and collar. Some of them will have a harness with some identification, but again, there's no requirement for a specific vest, collar, leash, or anything like that. Some dogs will actually work off leash sometimes. So, for example, if you have a dog that detects something that somebody's very allergic to, that dog may go out a little ways ahead of them, sniff for an allergen, alert their handler. So if there's something in the environment that that person's very allergic to, they know it's there, they know not to approach. But the dog has to be under command by voice or gestures. So once it shows them, okay, there's something over here, don't approach it, then they can call the dog back to them, etc. Okay? So sometimes somebody will use what we call a long line, a much longer leash, or even a retractable leash to allow a similar task. The other time you may see a service dog working what we call off leash, off of a leash, is if you have somebody who has PTSD, for example. That might be one situation where you're going to see the dog go in, check a room to make sure that there's nobody in it, and let the handler know, okay, it's clear to enter. And that can be somebody who's been through some very difficult life experiences. Just knowing that safety before you walk into a dark room, that yes, it's safe to go in, there's nobody in there, can be a huge help. So again, if they are off leash, they just have to be under handler control by either voice and gestures, etc. Okay? So I always say the ADA was really brilliantly written in this with such an eye for the future, because again, when we see how easy it is to get anything from any place online these days that says service dog, that's why we always come back to those two questions that we ask, because that is the identifier. Okay? So we talked about this just a moment ago, but just important to rehash. We can't ask somebody to have their dog or miniature horse demonstrate a task or skill. Okay? And we cannot request documentation that it's a service animal. When we talk about service animals, it's important to know what's not okay, because there's a lot of misinformation out there. And I'm so grateful for this opportunity to help talk with all of you to clear it up. So an animal that's not housebroken is where a service animal could be asked to leave a premises, okay? If the animal's aggressive, if it's running amok and the handler's not attempting to fix the situation, okay? And if for some reason like that, an animal is excluded from a premises, the staff still has to offer goods and services to the person without the animal being present. So again, it's an accommodation without the animal being present. Okay. And as you know, the ADA also does have an 800 number that you can call to talk to somebody for advice. I always recommend that because it's such a great resource. So the New Jersey Service Animal Working Group has created some really great deliverables. This is the first one. So this is a wallet card that anybody could print out. It's available on the New Jersey Department of Agriculture website under resources. You'll see service animals underneath the resources tab. And if you go down to there, this is one thing you could print out. This is such a great thing because let's face it, we all have a lot of things to remember every day. And when you're sitting there going, oh my gosh, what was the two questions? Oh my gosh, it's been a while since I've thought about this. Well, here's something that you can carry or put at your workstation where if you have a patron come in with an animal and you need to ask the two questions, you could just look at it really quick and go, okay, I know exactly what to ask. I know what to do here. And this is also a great tool for when you have a special event. So for example, if you have a county fair coming up and there's only exhibit animals and service animals allowed, this is a card that somebody at the gate can read from when they're getting tickets at the gate and go, okay, is this dog a service animal required because of a disability? And what work or task has the dog been trained to perform? So this is a resource because I'm a big believer anything we could do to make life easier on everybody. And so I hope that you find this as helpful as I do. So let's talk about if somebody in a location, we'll say an emergency shelter, if there's another patron who says that they have an allergy to dogs or fear of the animal, okay? So if somebody states that they have an allergy to dogs or afraid of dogs, what the ADA says is to offer to move the person who's afraid or allergic to a different location. The reason this is important to keep in mind is service dogs are like medical equipment. They are considered equipment, just like a wheelchair, just like a walker, just like ventilators, oxygen, etc. And as somebody who has used medical equipment for a long time, if somebody doesn't like the sound of equipment, so let's say somebody came in and says, like, the sound of that ventilator is bothering me. We wouldn't ask the person using a ventilator to move, right? We'd ask the person who said, hey, this is bothering me. We'd ask them to move and help them get to an alternate location. Okay? And sometimes you may have somebody, and again, somebody may have a serious allergy. Again, making sure we help people get to a different location, spacing people out, is all very important. I always recommend if you're involved with sheltering, helping with sheltering surveys, talk to people with service animals, talk to your local Center for Independent Living, and elicit the support of people with disabilities and the service animal community to help because there's so much valuable insight from that firsthand lived experience. So just before we talked about what is or is not okay, when we talk about aggressive behavior, running amok, etc., this page here is a copy of from the ADA directly about the animal must be under control of the handler at all times. Now, if you look towards the bottom, you're going to see something in red. This is a really important thing. I've encountered even personally, there's a lot of misinformation that service animals don't bark. However, service animals, very often the bark is the alert. So this is something that's really important to share. Service dogs are very often trained to bark to alert. Some will look at their handler and bark until the handler does what they need to do. That's part of their trained task or skill. Some will bark for the duration of a medical episode, for example, somebody having a seizure, to draw attention to their handler. So for example, if somebody's out in a crowded place or out walking around a park and their handler collapses, and that dog's like, they need more help than I can give, that dog is going to bark and try and get people to engage, to come over to check on their handler. Some will actually seek out the nearest person and try and get them to follow them back to a handler who needs more help than the dog can give. So it's important to know that barking is a task very often, and that is an acceptable behavior as a work and task that this dog may be providing. So a really great piece of information too is if you have a service dog, just practice letting people know if you're in a situation where it's important for you to do so, letting them know how your dog alerts. And I could share a story about that. Anybody here who's met me in public has probably met one of my two service dogs, and they're trained to alert if my breathing is getting really bad because I had lung surgery many years ago. And sometimes, because my lungs are always a little choppy, I'll kind of push through stuff. I'll kind of, I'm okay, I'm okay, I'm okay. Well, at some point, my dog will start bumping my leg and going, excuse me, you need to take a break. And sometimes I'll try and ignore them because I'm a little stubborn. Thankfully, my dogs are trained to be more stubborn than I am, and that's actually part of what we call willful disobedience, where sometimes they go, you need to take care of this now. So they'll start whining at me. And sometimes I'm like, okay, just a minute. And my dog's like, human, I know better than you on this one. They'll start barking. And that bark makes me go, okay, I really got to handle this right now. Okay, I can't keep trying to push this off because my dog is going to bark until I take care of myself. And if I ever was having a really bad day, my dogs will actually go and get another person and be like, hey, go check on her. So again, barking, it's important to know that this is a service animal behavior that can help get help to a person and also be a little bit more insistent when their handler, like me, might be a little bit stubborn. Okay. So a lot of you have probably heard in the news about what we call emotional support animals. And it's really important to understand the difference. So emotional support animals, I'm going to go into a little bit more detail in a moment. But it's important to know that emotional support animals are not service animals. And sometimes terminology makes it tough. You'll hear people say they have a guide dog. You'll hear people say they have a hearing dog, a PTSD dog. Maybe what they might call it a PTSD support dog. Maybe they call it a DAD dog, which stands for diabetic alert dog, or a medic alert dog. And you're like, is that a service dog? Terminology, sometimes we do it to ourselves. It tends to be a challenge because it isn't always clear to the general public, is it a service dog or not? So I always recommend think about it hyphenated. If somebody says they have a PTSD dog, I say think about it service dog hyphen PTSD type, service dog hyphen guide type, service dog hyphen hearing type, etc. But whenever you have a question, just always come back to those two questions. So if you're in a situation where you have to ask and you're not sure, is that an emotional support animal or is that a service dog? Just go back to those two questions from the ADA. Is the dog required because of a disability? And what work or task has the dog been trained to perform? Those two questions will help you clear the path forward. Okay. So I wanted to make sure I touched on the difference between service dogs, therapy dogs, and emotional support animals. So a service dog is covered under the Americans with Disabilities Act. It is a right to be in public establishments. Okay, service dogs have to be able to tolerate a wide variety of experiences, environment, and people. They may live with a person who has a disability, even if there's a no pets policy in place. Okay? And they are trained to assist just one person. So in the next column under the purple header, you're going to see what we call therapy dogs. So therapy dogs are a great resource for wellness. There's a lot of times we'll go to a class or special event now, and even around finals in a lot of colleges and midterms, they'll actually bring in therapy dog groups. So what a therapy dog is, it's not covered under the ADA or fair housing. This is a dog that somebody is trained up to experience and tolerate a wide range of environments, meet different people, etc., and to provide emotional support and comfort to many people. In New Jersey, we're lucky to have several therapy dog groups who have therapy dogs that if you're interested, you can look into because again, dogs do so much to help our wellness, and it's just a great resource. But again, a therapy dog, and this is important to know, in an emergency shelter, if somebody has a therapy dog that they bring to different events and everything with a nonprofit group, etc., that therapy dog in an emergency shelter stays in the pet area. And just a quick note on that is when you have an emergency shelter open, very important thing to know is there's something called the Pets Act. So Hurricane Katrina, there was a significant loss of life where people who had pets did not leave their home because they did not want to leave their animal. And unfortunately, many of those people perished. So laws were changed and something called the Pets Act came out of that. And what that means is if there's an emergency disaster and there's an emergency shelter and you have to evacuate, when you evacuate, bring your pets, bring your emotional support animal, your pet, your service dog, whatever the case may be. Again, service dogs go anywhere, but just know that with the Pets Act, every place has to have a plan so that if you're opening a human shelter, if you have to evacuate people, you're also planning for pets. Now, in New Jersey, we do very often what's called a co-located shelter. So you have people in, for example, if you have a big school, for example, say, you might have people in one gymnasium and animals in a second gymnasium. Or sometimes it might be like, a recreation center or a fitness center that's being used. And you might have animals again in one room, people in another. That's a very common, though it's not entirely across the board, but it's a common setup in New Jersey. But again, if somebody has a therapy dog that they do volunteer work, outreach with, etc., at an emergency shelter, the therapy dog stays in the pet area. And the same goes for emotional support animals, because you're going to see in this last column, emotional support animals are not covered under the Americans with Disabilities Act. What they are under is what we call the Fair Housing Act. Okay? So emotional support animals may live with their owners who have a need documented by a doctor, therapist, etc., even when there's a no pets policy in place if it's a reasonable accommodation. Okay? An emotional support animal doesn't have the training, socialization, etc., like a service dog necessarily. They do not have to have that, okay? Because their primary function is to provide emotional support through being there for the person, through being a companion. So to get into that a little bit more is remember, with an emotional support animal, again, come back to your two questions if you're not sure if it's an ESA or if it's a service dog who can go with the person anywhere in an emergency shelter, etc. Come back to those two questions. Now, with emergency sheltering, what is really nice is there's some additional resources that are going to be posted very soon on the Department of Agriculture website, which I mentioned earlier under the service animal tab, because there's going to be some additional guidance soon regarding emotional support animals. So I recommend checking back in there, because even though they're not service animals, there tends to be confusion about which one is which. So it's something to help. Okay. It's important to remember that if somebody's doctor or therapist said this person benefits from having a companion animal, even though the apartment complex, et cetera, doesn't normally allow one, that person has an underlying reason that the doctor or therapist documented that information. Okay. So this is where, if you're in sheltering, you look at what can we do to help that person with reasonable accommodations. So if you have somebody who has bad anxiety, but having their companion animal helps, we want to make sure that we can facilitate when reasonable, because disasters are always going to be challenging, but we look at what can we do to help, as far as maybe we can set up one corner of the pet shelter area for somebody who has an emotional support animal if we have the space and resources, so that they come and sit with it anytime. And that's just one thing. Again, it's very situationally dependent, but I'm going to say watch for that guidance document that's coming out soon, because it's got a lot of best practices that are already being used in different areas, compiled, so it's a quick, easy reference. Okay. And I touched on this before, but again, therapy dogs, one of the neat things with them too is sometimes, for example, American Red Cross has people who also volunteer with a therapy animal team. And the impact of those therapy animals when there is an emergency is amazing. They do so much to help people feel better, relax, have a little bit of normalcy, that stabilization. So it's important to make sure that people know where the therapy dogs are, and not to pet somebody's service dog who's working. So having a separate space, so in case there's any allergy considerations too, if you have therapy dogs visit at a shelter or at a special event, is important. Letting people know before they come in, okay, we have a room over here, there's therapy dogs if you'd like to visit with them. But if you have allergies, just know they're in that room over there. So that way somebody who needs to can avoid that space, etc. It's really important to let people know which is which, because again, we don't want somebody getting confused and interfering, petting, interacting with somebody's working service animal. So again, we touched on this, but it bears repeating that Service dogs work for just one person, okay? Covered under the ADA. And what they do is going to be based on the needs of the individual, and they are considered medical equipment. Let's talk a little bit more about what that looks like. So, service dogs or miniature horses who are guide animals can help somebody who has vision differences navigate or orient. So it can be tasks like finding an empty chair, finding exits or emergency exits, finding bathrooms, safely crossing a street. And I mentioned this earlier about willful disobedience as a safety task. It's not just for guide animals, but if that guide animal sees that there's traffic coming and it stops so a person can't go across a crosswalk, again, willful disobedience is a task to help keep somebody safe. Service animals also can help for people with autism. So depending on individual needs, there's a lot of different tasks, which, as one of my dear friends has said, very much there's some similarities to dogs who also do work for people with PTSD or people with psychiatric disabilities or other neurological conditions as well. So the dogs can sense anxiety. Service animals could sense anxiety, intervene. They can do medication reminders, or they might remind somebody to take a medication at specific times every day. They might tell somebody if they're about to go into a crisis and help them redirect, nudge them to distract them, do things like provide deep pressure where they'll actually crawl onto somebody's lap or even lay on them to provide that deep sensory pressure. For some people who may elope for different reasons, a dog or miniature horse can sometimes help with that as well. Again, all of this is very individual. Always talk to your healthcare providers, your therapy team, see what's right for you as an individual, and work with your care team and your support network. But one task they might do is sometimes you'll see service animals who are tethered to an individual. So they might have a harness, like a backpack harness, and a leash to the dog, or a hip harness and a leash to an animal to help prevent elopement. And the animal will just lay down if a person starts to go to someplace where they should not, safety, etc. Okay? And they may even block a doorway, help redirect somebody as well. Another thing we talk about with a number of disabilities is blocking to make space. For somebody who's not comfortable with other people getting too close to them, animals can be great at creating that barrier. So if you've ever been in the supermarket and you've had somebody who just kept kind of creeping up in your space, and you're like, I'm getting a little uncomfortable with this. Well, for somebody who needs additional space, that service animal may actually stand between and just gently block so that somebody can't come too close behind you. Okay? And another really neat thing is social bridging. So if someone has difficulty with eye contact and social interactions, anxiety, having an animal helps to connect people. Because how many times, if you have pets who, even if you have a pet, how many times have you bonded with somebody going, oh, you know what? Oh, I have a peach cheek conure too. I have a bird, I have a cat, whatever the case may be. Having that shared experience helps us bond. And so service animals too can also help with social bridging. Okay? Any questions so far? All right, friends. So let's talk a bit about service dogs like my own who do medical alerting. They can do medical alerting for a wide range of tasks. I talked earlier about how mine help if my breathing is getting too bad and I'm trying to ignore it. So there's some dogs who will help somebody with diabetes, also with different breathing problems, heart problems, seizures, and so much more. And we talked earlier about barking as one way they may alert. They may kind of bump you with their nose, they may paw at you, they may whine, they may actually even stand up and touch you with their paws, push against you, any combination of those. And some can call for help, actually by pressing a button. So if you haven't done it yet, go on Google and look up Echo the Service Dog. And Echo the Service Dog, I love those videos because they're such a good, concise good concise video, but it really shows the worker tasks. The dog knows that its handler's about to have a seizure. It alerts her. It hits a button to call her partner and let them know that she's about to have a seizure. It runs to the fridge. It gets her rescue medication and it protects her head. It's incredible. But these are all examples of work and tasks that service animals may perform. And I've said this many times with my own service animals make our worlds bigger. Okay. People with long-term serious medical conditions might not feel the warning signs of an imminent emergency, or we get a little stubborn and we all like to kind of push past our limits. So again, sometimes our service animals, they just have to kind of remind us, hey, you're not Superwoman, not Superman, not Superwoman. You need to take care of yourself and you need to do it now. And I always say some can be very dramatic when you aren't listening. They have to be a little louder. Ruff, ruff, ruff. They might have to kind of stand up, sometimes even push against their handler to say, you need to sit down. You need to handle this now. And again, to get that attention. So you hear a dog barking and barking, barking, you're probably going to look over, right? That's the dog letting you know, hey, my handler needs help. Okay. I always recommend if you're out and about and there's somebody with a service animal and its behavior suddenly changes, that's a good indication to keep a watch because they may be about to have a medical or other episode. And so sometimes it just comes down to asking somebody, is there something I can do to help you? And if there's somebody in your life who has a service animal and you have that relationship, it's worth talking to them and saying, hey, what does an alert look like for your service animal so that if I ever see it, I know. And if I see it, what can I do to help you? Because again, for many of us with all different disabilities, we navigate every single day with stuff that other people will be like, not sure what to do here, right? And for us, it's our normal, but other people might not be familiar with that. So for somebody who has frequent seizures, that might be their normal. And they'll say, hey, you know what? Unless I have a second one today, you know, I'm okay. Let me and my dog do our thing. But if there's a second one, call 911. Again, that's just an example. Always talk to your doctor, healthcare team. But again, that's just an example of why you have those conversations and ask, what does it look like if your dog alerts? What should I look for? And is there something I can do to help? Because they might say, hey, just make sure that, I come out of it in about 5 minutes, whatever the case may be. Have those conversations with people who you can. Okay. So one important thing in emergencies and disasters is very often when you have people who have more complex situations as far as health needs, equipment, etc., they may become to a point of not getting outside as much, not going as many places. And sometimes transportation, as we all know, can be a challenge in some areas, etc. So even a service animal that's previously been very well socialized, comfortable in a wide range of settings, that ability, that capacity of the service animal can kind of fade if they're not getting out as much. And that's something to be aware of, is that that service animal is still working, still taking care of its human, but in an emergency, a disaster where they have to leave the house, that animal might struggle more. And I heard a great example recently where a colleague was talking about at the mega sites of one thing they did was sometimes if they had a situation, because during COVID, a lot of service dogs weren't leaving the home as much with their handlers because, especially for people with other conditions, we had to stay extra safe, right? And so those service dogs were getting a little bit stressed out when they were coming into the mega sites with their handler. And so they actually had to help people get over to a quieter area with their animal to help the animal relax. So an important resource is if you're involved in anything emergency disaster sheltering, is again, look to that service animal resource page on the New Jersey Department of Agriculture, because you're going to be seeing some additional guidance about best practices and planning to help service animals, because just like people, animals do experience certain stressors in disaster. So let's talk a little bit about what that looks like and the issue with disasters. So animals are hardwired to sense changes in their environment. It's survival. All right. Any of us who have a little bit of arthritis, we kind of know that sometimes we know the weather before we get the weather report, right? So animals feel the weather and the changes in their environment to this amazing degree. It's truly remarkable. It's one of my favorite things as far as, doing the research on this and working with a team of folks with the Service Animal Working Group, hearing all that information. Um, so when you take somebody out of their home, like we talked about, if somebody has to go to an emergency shelter in a disaster, their service animal might not be able to carry out tasks that it normally would. So when I talked earlier about if a dog fetches medicine from the refrigerator and now that person's in a shelter, there's no refrigerator. Maybe it usually goes and gets a caregiver from another room. Well, what if somebody's caregiver isn't there and now you're in a building that's not home? Imagine what that's got to be like for a working animal to go, this it's a very, very challenging situation for them. And so that's where we talk about things like, well, we always want to make sure we never segregate anybody, obviously. We want to make sure that people have the option of a quiet space when it's reasonable, because in a disaster, things are always going to be imperfect. But when it's reasonable, if there's a way to have a quiet area, so in case a person's service animal needs to decompress a little bit, it's going to help. All right. Another challenge with disasters is the public generally is not as familiar with service animals, roles, alerts, and behaviors. Okay. So imagine this, you have a couple hundred people who are all sleeping in a big dormitory or trying to sleep. All right. Everybody's laying there, mostly staring at the ceiling because they don't know if their home is still standing. And as they're all laying there, it's the middle of the night. People are exhausted beyond belief, worried beyond anything. And all of a sudden, in the dark, a dog starts barking loud. Huh. That's going to be a rough situation because people may not realize that service animal is alerting. Okay. And this is where proactive education is so important. And I'm so glad I get to talk with all of you today about this for exactly that reason. If we can help get the word out, if somebody's oxygen equipment started beeping, you'd probably be going to the shelter manager. Hey, can you have the nurse check on that person? Can you check on that person? Their equipment's beeping. I'm worried. Service animal barking should be no different. Okay. So to talk just a little bit more about other reasons why disasters can be stressful for service animals is, let me ask you something. Think back many years ago when you were younger. Did you ever kind of scuff your feet on a rug and then zap a sibling or friend, a little static zap? Well, think about this. An animal's body is covered in hair, all right? So they are like that wool sock every day. So if the air is really dry and more staticky, if there's an electrostatic change in the air, they're going to feel that, just like when we used to kind of go over there, scuff our feet and zap our friend, right? So the other thing too is that they also feel that pressure change. I talked before about if you have arthritis, you probably kind of know the weather before it's coming. Animals feel that too. So these are all survival things, built-in features. And so the challenges though, and think about things like how sensitive their noses are to smells. You have a wildfire situations like that. All these survival built-in evolutionary features can make it harder for them to focus. Okay, so that's where anytime we can help, ask the handler, hey, you know what, is there something that's going to help you and your dog if they get to an emergency shelter? Is there something we could do that's going to help make things a little easier for you? Sometimes if you have a big open room and that's it, it might be holding the corners of the room so that a service animal and a handler can get into that corner, so there's at least two walls there so that they have a little space there to kind of just help the animal decompress. Okay. Sometimes, again, it's going to be trying to have a room, an optional space somebody can go to if they need it. Because, again, if their dog starts alerting, some people might have to use an injectable medication or do other procedure treatment that might not be familiar for the public, and it might also be for them, very private matter. So again, we just try to be mindful of that. And that's where also bringing in your medical reserve corps, um, your medical trained personnel at a shelter is important to all work together. And also your what we call disaster response crisis counselors, DRCCs. It's always great to have them involved from early on in any emergency disaster to help people as well. Okay. So I mentioned earlier, and I just want to make sure I bring your attention to this page where we have the link for the Department of Agriculture's Animal Emergency Site. All right. And we're going to be having that group will be posting their fast facts cover sheet and detailed description about service animals, the rationale behind those guidance items for sheltering operations. So we talked about looking for an option of private spaces, optional private spaces if somebody would like to use that. Even doing things like hanging sheets to reduce visual stimuli if you're in a big open room may be beneficial. Because just like anyone who may have sensory integration, it's very much it's very similar where whether it's sensory, very much there's a lot of overlap as far as reducing that stimuli because for those of us with disabilities, sometimes we need that sensory relief, right? And very often our working animals may as well. Okay. So things like hanging sheets, creating that slightly smaller space can be helpful when it's possible. We talked about making sure, and again, it just bears repeating, doing things like holding open the corners of a room so that somebody who comes in with a service animal asks them, what works best for you? But try and hold those corners that if somebody needs that space, if there's nothing else available, at least the dog has those two walls, miniature horse has those two walls, just to feel a little bit more safe. Okay. A person who is blind, ask again, you always ask the handler what works best for you. They might prefer to be by a wall, so they could also orient physically to where that wall is and tuck their dog in without having to worry about people tripping on it, stepping on it, etc. Because unfortunately, it does happen. My poor dogs have had people trip on them, and it's like, oh my gosh. No matter how careful you are, no matter how much you tuck them in, sometimes people just are not mindful of where they're going. And so this is why we always make sure we think about how can we help keep the animal and the person a little bit safer and asking what works best for you, because that's what we always come back to is what works best for you, because that dog and that handler, they work together every day. Okay. And again, we talked about being aware that the stimulus of a mass care setting, a shelter setting, is going to be difficult. And this is why it's so important too for any of us to really look at planning as best we can to have an alternate plan. So things like having a friend who we can go to, a family member whom we can go to. If we're able to budget over time for things like going to a motel, and there's things in New Jersey, it's worth looking into different resources. Again, talking to 211 in advance, looking into things like NJABLE, talking to disability services, seeing what's out there to help you with that, because shelters are a lifeboat. They are uncomfortable. If you've ever slept on a camping cot, you wake up with aches and pains that you didn't have the day before. It'll keep you safe. We want you to come with your animal if you need to, but I will tell you what, it's always more comfortable and relaxing to find a family member or friend to stay with or to be able to budget towards a motel if that's possible. Okay? So just keep that in mind. But just always know if there's an emergency shelter, bring your pet, bring your therapy animal, bring your service animal, emotional support animal, whatever the case may be, bring your animal with you. Okay? So one thing that's important to keep in mind too, and I mentioned before about alerting, is sometimes a service animal who provides medical alerting will actually alert to somebody else who's having an exacerbation of a health problem or other need. Okay. It's very stressful the first few times that happen, and it actually happens a lot because when you have a service animal who's trained to that person's blood sugar is getting low, it's getting high, there's something going on here, their heart rate's too high, their heart rate's too low. Whatever the case may be, if you're a handler and all of a sudden your animal starts alerting, or something's wrong, and you're checking yourself and like, but it's not me, I'm okay. Your first thought is like, oh my gosh, did I break my dog? It's really stressful. So if you ever see somebody and they're like, oh my gosh, my dog won't stop alerting, and the person's like, I'm okay, I don't know what's going on. Try and get them to a separate space so they and their service animal can decompress. And then, and reassure them, okay, listen, take a moment, just take a moment with your animal, settle, take a few minutes, settle in, relax as best you can, give them a little extra space. And then what I tell everybody is watch the room they came from too, because very often a service animal will alert to another person about to have an episode. Um, and so, whether they smell that somebody else is having a problem, they can hear our heartbeats and our breathing all the time. Maybe they sense somebody else is having an issue right now. Watch the room where they came from in case somebody else is having a problem. Okay? So, there's a really great flyer available again through New Jersey Department of Agriculture, developed by the Service Animal Working Group. And there's something we call the 3 rules. And whether it's an emergency, disaster, or just interacting out in public day to day, the 3 rules for service animals are what we call no touch, no talk, no eye contact. Well, what does that actually mean? Well, it's important to give service animals space because we don't want to distract them. So, for example, if you have an allergy dog that's going out ahead of somebody trying to see if there's an allergen, something bee nest, something that they're allergic to in the environment, we don't want to distract that dog from its task. It's important to avoid eye contact with a service animal, whether it's a dog or a miniature horse. And the reason is, if you've ever felt uncomfortable because somebody's staring at you, they feel the same thing. Staring for animals is very much a predator behavior. Animals that want to hurt them stare at them. Okay. Animals that are thinking that they're about to become dinner stare at them. So for service animals, it's very important not to stare at them because eons of evolution, to them, that's something that might hurt me. And it's a distraction. No matter how well focused they are, no matter how good they are, it's very difficult if somebody's staring at you to focus on what you need to do. And I'm sure we've all kind of felt that the same if we've had somebody who's staring you down. You're like, what's going on here? Makes it a lot harder to focus, right? It's the same thing for our service animals. And just like we tell everybody all the time too, speak to the handler, not to the dog. I don't know. Everybody here is cringing, going, oh gosh, but we've all had somebody who talks to a family member. We've all had somebody who talks to a home health aide instead of talking to us. Same thing, just speak to the person, not to the dog. And remember, as we talked about and touched on several times, because it bears repeating, is if a service dog is barking, it may mean that their human needs medical assistance. So again, ask, is there something you can need? If you're in a shelter, let the nurse or the shelter manager know right away, hey, I'm concerned. Can you make sure this person is okay? All right? And again, this poster is available for free for you to print from the Department of Agriculture website. So before, you heard me mention early on, I said I have service dogs with an S, plural. The ADA recognizes that a person may have more than one service animal. And that's because maybe one can't do it all. And also our needs, people change over time. We get a little older, health needs change. One dog can't always do it all, or maybe it was trained for certain specific tasks, but as time goes on and our bodies change, situations change, we need something else. So we need different tasks. And again, there may be a second animal. We do see that when we open emergency shelters in different places where somebody will come in and sometimes it's their older dog and the younger dog who have 2 very different skill sets. But again, just be aware of that the ADA recognizes a person may have more than one service animal. So here's an important one too. Must a service animal be allowed to ride in the ambulance with his handler? The answer is generally yes. Okay. So if the ambulance is crowded, so generally the answer is yes. Okay. However, if the ambulance is crowded and the dog's presence would interfere with emergency medical staff's ability to treat the patient, staff should make other arrangements to transport the dog to the hospital. So if you are a service dog owner, handler, miniature horse who is a service animal, again, just make sure you're familiar with that. And also make sure that you talk to the people in your life who are your support network and go, if I ever had a situation where I need help taking care of my animal, what do I do? Who can I call? Is there somebody I can lean on? Okay. Because if somebody's really, really sick, sometimes if they can't take care of their animal in the hospital, it's important to make sure you have something set up so somebody can assist you. So this comes back to our planning ahead of time for any of those contingencies. And one thing that's important to note too is most people obtain their own service animals by either rescuing an animal, purchasing an animal, and then training it themselves or with the help of a trainer. So, and the reason I mention that here is while some people get their animal, their service animal through an organization that trains it for them, many people train their own or have a trainer who helps them train their own. And the reason is that usually there's a multi-year wait for a service animal through a nonprofit organization. And the other issue is that while not all of them charge for the animal, some do have a cost share, which for people on disability or other limited sources of income can be a bit of a challenge. And so in that case, some people actually go on to become trainers themselves or have a trainer who helps them. Now, the reason this is important, because as I mentioned, making other arrangements, if you got your animal through an organization that trained them, make sure you know what their policies and procedures are as far as if you ever had a serious issue, would they have somebody who can temporarily foster your service animal? Because we know that service animals do not do well put in a facility like an animal shelter. Okay. So this is why it's important to plan ahead for their needs as well. So know if they have a program where somebody can help watch them or foster them. Know what you need to take care of, know what they may be able to help you with. And if you trained your own dog or work with somebody to train it, again, plan for those what ifs. What if I have to temporarily stay someplace and, I'm not able to take care of my animal? Who can help me? Who could watch them if there is an issue where I cannot for a while? And that also is a matter of making sure too that if your dog has a microchip, we are all on a budget, but your microchip there's a company who manufactures them. Find out from your vet which company that is. And usually you can register that microchip and keep your information up to date. So they charge a yearly fee. And I know it's tough for anybody who's on a budget, but that yearly fee lets you do things like update phone numbers, update contact information, update your address if your address changes. Let's say that there was an apartment fire and you had to temporarily relocate while your apartment's being renovated and your service animal or even a pet gets loose. You want the people who find it, your animal control officers, your local shelters, rescues, etc. You want them to know your current phone number, your current address. So this is why it's important to look into that and, see what you could do to help make sure you keep that microchip information up to date. All right. So other emergencies. Okay. This is more for people who are involved in response and planning, but for any time you're interacting with animals, we always recommend you want to make sure you have what we call slip leads if you're working with dogs, which are basically they're literally it's a special lead that slides on and off, and you could basically infinitely adjustable, and it's important to have a supply of those. Okay. And that's one of the tools I mentioned earlier, where having a slip lead is good to have in your go bag as a backup to your leash and harness. You want to make sure you always have 2 leashes on your animal at any time. So if you have a regular leash and collar, maybe look into a slip lead, etc. Okay. And There's a really neat tip that I learned from Phyllis over in Burlington County, and that's service animals are what we call equipment driven. Okay. Working dogs know that they're working because of what they're wearing. So, yes, they listen to commands, but a big part of what cues them to work is what they wear. So, it's just like when we put on a suit and, we feel a little different. We're sitting up a little taller. We're like, I'm in suit mode now, right? Our service animals are the same way. That harness goes on, they're like, all right, I'm in work mode now. So, one of her suggestions was if you have an animal where the harness is damaged, lost, whatever the case may be, can't be used after a disaster. And now that person is in your emergency shelter with their service animal. Sometimes things like a wide 6-inch ACE wrap is a good thing to keep in your supply kit because if that harness is lost, you can gently wrap that wide ACE bandage around the dog where its harness normally sits to give it that gentle cue that's in work mode. It's wearing its suit for work now. Okay. And the other thing is just remember that if somebody is a service animal and now it's out of harness and that harness helps with guiding or mobility, balance, etc. If you're involved in planning, make sure that you have things like wheelchairs, walkers, canes on standby until that equipment can be replaced. So the last one is a question that comes up every so often that I just want to touch on this slide. I'm not going to lie, I had a little too much fun making this graphic. I just thought it was too cute. But what about pools? So the ADA doesn't override public health rules that prohibit dogs in swimming pools. So if you go to a public pool, your service animal cannot go in the water with you. Okay. However, if they're up lounging on the pool deck with you, that's okay. But again, they cannot actually go in the water. All right. So again, plan ahead for them, for their needs. And again, if you make sure you work with your veterinarian, your trainer, make sure just like you've made a go bag for yourself and a shelter in place, staying home for a couple days kit for yourself, make sure you also do that for your animals. And the last thing I want to make sure is that you see this information slide. And you can go to the Department of Agriculture's website. The Americans with Disabilities Act information line is on there. ADA data fact sheet about service animals. It's also a great resource because this is where you can see about that. It's a quick read on the separate provision for miniature horses. And then you have your ada.gov resources as well, your FAQ for service animals. And then there's a really neat link, which is from, hang on one moment, which is actually from the AKC. And the American Kennel Club has some really great publications about what to do if you have a service animal or any pet to help plan for disasters. While it's geared towards dogs, it's things like making sure that you have your, a kit together for them. Okay. So now we're going to come to our last item. So I hope you'll take some time to look over those links and resources. The AKC, the American Kennel Club, also has a really fantastic resource on crate training, which is something that I mentioned, because if you do have to go to an emergency shelter with your pet, they do stay in a crate while they are in the shelter. And that's because if you have a whole bunch of dogs, cats, everything else, we have to keep them physically safe. So that crate is their safe space, that's their den. And so if you go to the AKC's website and you look at crate training, they have a crate training in 9 easy steps. It's a really great resource. And again, always talk with your vet, with your dog's trainer. But that's something where it helps your dog feel more comfortable. Just like if you have a cat, talk to a trainer, talk to your vet about getting them acclimated to their carrier. So if you have to take them to a vet visit on a regular day, or if you have to evacuate in an emergency, they're more comfortable with their cat carrier, or if a dog, you have their kennel. That way they're going to feel so much better. They're going to know this is their safe space, be more comfortable going in and out, and that's going to help take their stress level down as well. So with that, my friends, I want to thank you so much for your time and the opportunity to talk with you all today. And I know the works cited references, different resources that you could check out will be attached for your review. So please check out those links. Remember to look up the New Jersey Department of Agriculture's Service Animal Resources. And thank you again for your time. Have a great day.
Thank you, Karina. This was great information, wonderful presentation. I need to
No way in.